Welcome to the Registry Insider. I'm Bill Seifert, the CEO and Executive Director for the National Registry of AEMTs. And today we're talking about the continued competency agenda for the future and what it means certainly for us at the National Registry, but more importantly, the broader EMS community, the system. Joining me today are Dr. Kim McKenna, who is the chair of our assessment committee here at the National Registry of EMTs, as well as Dr. Scott Gilmore. He is the executive committee member as well as chair-elect and the chair of our steering committee on continued competency. So thank you both for joining me for this conversation about an important topic. So continued competency agenda for the future. Scott, what is it and why are we worried about this?
So the continued competency agenda for the future, it's to add to the other documents that are already out there. With the EMS Agenda 2050, the research agenda, et cetera. And the one thing that we found when we've looked through all of these other documents is continued competency was kind of mentioned, but it was never fully explored, for a better description of it. And that's what we're trying to do, is we're trying to finally put that final piece in with all these other agendas to complete the picture of the agendas. Now, why is it important? Well, we're trying to figure out exactly what is the best way of ensuring continued competency. Mm-hmm. And we have a couple goals with this, to make it easier for the registrant themselves or for any other licensed individual, because this truly isn't a document just about the National Registry. It is for the whole EMS community, which is reflected in the steering committee as well. Mm-hmm. Within the steering committee, we have members or representatives, I should say, from a lot of the various EMS associations,
around 20 organizations,
federal partners, quite a bit. And it truly is for the EMS community. And as I was starting to talk about, why is this important? Well, we want to make it so that it's meaningful, it's value added. And those are two things that we've really never had in the past. And we really need to get to that.
In this document, you mentioned the EMS Agenda 2050. I'll mention the EMS Education Agenda for the Future, a systems approach, which was written in the year 2000. It actually called for the creation of a separate document focusing on continued competency and continuing education like 24 years ago. So this is long overdue.
Well, like everything in EMS with our agendas, we don't want to push things too quickly.
No. Don't want to rush change.
Well, it's not only just change, but also when we're looking at this, we're truly doing it as a systems approach. Mm-hmm. So, like I said, we're involving all these different organizations, associations, and other EMS partners. And the reason why is because of the way we're developing the document. Mm-hmm. So within the document itself, there's various perspectives. But the one thing that's vital to all this is that we're remembering that it is a patient-centered model, because truly that's what competency is for, is to make sure that we have the best outcome possible for our patient.
It's also consistent with the EMS Agenda 2050.
Yes, very much
very
so.
Patient-centered.
Yeah, very much so. Now, what's interesting, though, about how we're approaching it this time is, like I said, we have these various different perspectives. And, the perspective of the medical director is going to be very different than the perspective of, let's say, the employer. Mm-hmm. The medical director focuses on clinical tasks or skills or knowledge, whereas an employer, yes, they want that, but they also have to worry about things such as professionalism, mm-hmm. empathy, how you operate a vehicle, making sure that you operate it safely, how you move patients and making sure that you move them safely, how we make sure that we retain the workforce, because as we know right now, we have a challenge with that. Mm-hmm. And these are all skills that are outside of, the realm of the medical director specifically. Now, the third piece, or the third perspective that really ties into the key perspectives that we're looking at, is the EMS clinician themselves. Mm. Uh-huh. Because it truly is up to the clinician. As a provider, regardless of whether you're a nurse, a respiratory therapist, anybody else in allied health or within the house of medicine, it's up to you to maintain your lifelong learning.
You have a professional responsibility to do that.
Professional, moral, ethical, whatever you want to call it. There is a responsibility there. And because of that, we want to make sure that it is value added and it's not another additional burden that's placed upon the EMS clinician. And so, those are the core three perspectives. And then when you'll see in the document, we actually have a diagram that shows this.
Mm-hmm. The wheel.
The wheel, yes, exactly. And then surrounding those three perspectives, you have three more perspectives. You have the regulator, you have the educator, and
the association.
The associations.
I'll help you out there.
Thank you. I'm like, I know I can list them in order, but I can't remember them exactly. So with the educators, and I'll let Kim speak to this more about that, but obviously the educators have a role in this too. The associations do by supporting the EMS clinician and assisting with some education and being an advocate, as well as the regulators. But the reason why they are in the outer ring is they provide a support mechanism or additional help for the inner ring, because it's truly upon the employer, the clinician, and the medical director to ensure the competency to make sure that we maintain that patient focus.
Mm-hmm. Good. And then on the most outer ring is the payer public. The public kind of has some expectation, and the payer, insurance companies, as well as tax bases or whatever the system may have locally, that's what funds the abilities to certainly have EMS, but also to ensure continued competency. So really what you described through this perspective, Scott, is a true systems approach to ensuring continued competency, which is what was called for in 2000. And I think we've developed through this consensus process, through this committee over the last three and a half years, a visionary document that describes kind of what this should look like to ensure continued competency. And from here, we'll develop a roadmap. Right. And the roadmap will kind of give us the how to do that. So exciting stuff, exciting work. Thank you for your leadership on that, by the way.
So you talk about the roadmap. Is there like a date or a horizon that we're aiming for with this document? I mean, it's like the agenda, it's 2050.
Yeah.
But is there a time frame with this one as well?
Yeah. And I think that as I recall, the committee was very intentional about putting a 2030 timeline on it so that there's a little bit more pressure to get the wheels moving. Ultimately, some things we can't get fully implemented by 2030, but certainly we can get well underway. And this visionary document of thinking differently about continued competency, I think gives us a lot of hope and a lot of realistic low-hanging fruit items that we can achieve by 2030.
One, it wasn't just the impetus to put pressure on people too with the 2030. It was also, we understood that, technology is going to change too.
Yeah.
We don't know how technology is going to feed into this. So for example, right now, AI is a big factor in everything.
Yeah.
But when we first started meeting with this group 3 years ago,
it was not.
It really wasn't. So I'm grateful that we did set it to 2030 so that we can reevaluate what technologies are available and how that can aid in establishing continued competency and assessing for continued competency.
So it's an exciting document. Let's switch gears a little bit. Let's talk about from an education perspective. Kim, obviously you have just a tad bit of a background in education, a little bit of expertise in it. So obviously one of the premises of this is, Scott talked about that this continued competency should be simpler and more meaningful, certainly for the EMS clinicians, but also the whole system. It also, our current research model at the National Registry and frankly all states is continuing education only model. What are your thoughts on that from an education perspective? A Con Ed only model, does that equate to continued competency, or are there opportunities for thinking differently about this?
Well, I think continued competency sort of needs to be thought about just like the whole EMS system. It should be a systems approach. And so just doing one thing to assure competency by having people sit in a chair or on a screen is probably not going to be sufficient to assure that people really are competent. And so we need to think about it in different ways.
Yeah.
We need to engage the learners. We need to assess the learners to assure that they are maintaining that competence, that they're not just sitting in a room, whether they're sitting in a room or sitting behind a screen, are they really attending to the information? Are they being presented with important information? And so part of that is, are we presenting them with evidence-based guidance about what is really new and what is really important in our industry. So we need to think about that. We also, and I think COVID pushed us a little bit more in that direction, we need to leverage the technology in effective ways to deliver education in ways that we haven't done before. And Scott mentioned AI. But I think, VR, AR is really emerging quickly too.
So simulation.
Yes, simulation for sure needs to be expanded upon. And thinking about like the time segments too, thinking about maybe having micro lessons or micro sessions where people can take small bits of information and fit it into their workday and be given credit for it, and be given credit for some of the things that they are already doing on the job, hot washes after difficult calls or mass casualty situations, those things.
Where learning takes place.
Where really important learning takes place as well. So I think there are so many opportunities to assess people and hopefully assess their knowledge over time to assure that they are not only retaining the core material that they need to know, but keeping up with important technology, important kind of concepts in emergency care so that they can really deliver to that central element of the wheel, the patient. So the patient can be assured of having a competent provider show up at their door.
I say it often, when you call 911, you don't get to choose the medic or EMT that shows up.
No.
Why is if you have a dermatologist, a lawyer, any other profession, you get to choose that. You can go online and look at the ratings of those physicians. You don't get that with your paramedic. So that's where I said earlier, the public has an expectation, obviously, that EMS arrives fast, right? When you're in an emergency and seconds count, you don't want them to have minutes till they arrive, but they expect that. They also expect, to a large extent, competent providers to show up.
They trust us. And we need to continue to retain that trust.
That's right.
By assuring competency throughout a person's work life. An athlete has to continually work to retain their skills and their fitness, their ability to do their job. And we definitely are no different in the EMS profession.
Right. Scott.
And, to emphasize something that Kim was saying, yes, it is continuous and ongoing. And that is something that is kind of a new concept.
Yeah.
Even though we've always said, okay, you need to get your Con Ed hours over your relicensure period. We all know very well, and I've done it myself when I was a paramedic, that I waited till the last 6 weeks, and I was like, okay, what can I knock out as far as my Con Ed hours? Whereas this is, emphasizing more that it's a continuous model and
a lifelong learning.
Yes, and with that circle, it's continuously ongoing. Another thing that I'd like to add too is, how you were talking about the micro learning. Let's take an average provider and say, hey, you know what? They've ran 7 cardiac arrests in their last 2 years, and they ran them appropriately. Okay, maybe a QA/QI officer or a medical director could sign off on that, and you've hit most of your CRV requirements. But
CRV meaning cardiology, airway, respiration and ventilation. So a couple different domains there.
Right, a couple different domains there. However, for some reason you haven't you haven't cared for too many traumatic patients. Well, maybe you need a little micro learning in that area instead of going and making you sit through that refresher course again, covering material that you've already mastered and you continue to show competence in. So that's how we're looking at one way of making it more meaningful for the provider as well as simpler.
The individual sort of that needs assessment, like what is needed to retain competency for this person within this period of time.
Yes.
So two questions come to mind. One is what you just said there, that individualized competency model, which, it may take me 15 tries to do a skill, and Kim, it may take you 2. So there's variability between each learner, and we need to be mindful of that, respectful of that. But also our experiences as clinicians is different as well. And to Scott's point, maybe we need to tailor it to the individual needs. So as it relates to a comment you both made earlier, evidence-based guidelines, what role do evidence-based guidelines, which, by the way, we'll put in the section below, the link to the Pre-Hospital Guidelines Consortium, the PGC. You can go to prehospitalguidelines.org to find a list of vetted evidence-based guidelines that could be and should be incorporated within education programs, continuing education, to protocol development. What role do EBGs play or evidence-based guidelines play in continued competency from an education perspective, Kim?
Well, I think, we have a lot of information coming at us all of the time. And it's really sort of hard to triage that information to determine what is the most important information for us to know to move forward in our practice of EMS. And the relationship that the registry has with the Pre-Hospital Guidelines Consortium allows us to look every 2 years, and that group of experts is going to examine the evidence that's out there and also look at the 10 most impactful articles that are out there and make a list for us, boil it down, give us a synopsis of each of those papers so that the educators can actually go and say, what should I be teaching? And the individual learner, the individual paramedic can also go there and say, oh my gosh, I didn't realize this had changed. I didn't realize that these guidelines for the head trauma patient were so important and made such a difference in patient outcome. And so that is going to be one tool that the educators and the clinicians can use to sort of move forward in their practice when they're trying to maintain that continued competence.
So not only is continued competency an opportunity to show continued competency of skills and old knowledge, which used to be part of this quote unquote refresher, but rather it's relevant as well because we have current content. We have an opportunity to make sure that the best practices as an EMS clinician through research is something that we can look to and incorporate as part of our continued competency.
Yes.
Medicine's very dynamic and it's necessary.
My colleague, Connie Matera, always says you can never teach the same lesson twice. That should be a mantra of EMS educators when it comes to continuing competence, because you have to keep up so the clinicians can keep up.
Scott, obviously, as a physician, that resonates well with you, I presume, because obviously, as a physician, your continued competency model necessitates you to stay up to date on current practices.
So yes, it does. The nice thing is just like what the PGC does with identifying the most important guidelines and the most important articles, my own boards sit there and do the same thing and say, these are topics that we need to focus on, and let's really focus on this to provide best patient outcomes. And I'm glad to see that it's starting to move into the profession of EMS and starting to be adopted by EMS. So that's very helpful. And then just even as a medical director, I'm not going to lie, I'm busy just like everybody else. And it's nice that somebody has taken the time to look at these. And I know, hey, this is the highest level of evidence that I should be looking at to make sure that the protocols that I create help to provide the best patient outcomes. So it's a win-win situation.
So as it relates to this continued competency agenda, and the title of it, which I haven't stated yet, but will be the National EMS Continued Competency Agenda for the Future, a systems approach. And we've emphasized, just like the EMS Education Agenda for the Future, which had 5 components, we are taking the similar perspective of having this as a systems approach where it's not just the EMS clinician, it's not just the regulator or the educator or the medical director or the association. It's everyone that is involved in this, and we each have our own role. It's also not just the National Registry that ensures continued competency.
That's right.
It's got to be a systems approach, and we can't do it in isolation. We've got to do it as a system. So with this document, we're on, as of this taping, we're on one of the final drafts, version 7.0, as of late April 2024. We will be developing a roadmap, and this will be circulated in 2024 for consensus across the nation. What's next then, Scott? Where are we taking this with the roadmap? The roadmap's going to give us the how-to, the agenda is kind of the vision of where we want to go by 2030 and beyond. But what's after that?
So obviously, continued competency isn't something that's going to go away. So yes, we've already said that the horizon for this is 2030. We anticipate bringing a group back together again and reevaluating the document in 2028, 2029, so that we can see what technology has changed. So we can see if there are new innovative approaches to ensuring continued competency. And so it's not just a one and done. It's something that we're going to have to do again. And it's something that the EMS community is going to have to realize that we need to keep doing this. It's not the visionary document as far out as like the EMS Agenda 2050.
Yeah.
Which
is truly visionary.
Which is truly.
With a lot of unknowns.
Exactly.
So there'll be a continued focus on continued competency, I guess is the way to look at it.
Yes, a continued.
Yes. More to come. So anything else to share about continued competency agenda for the future? I mean, from my perspective, I will say, I think it's exciting, and it's giving us a fresh perspective of how we can better ensure continued competency without continuing education alone. Not saying, and one thing I will say, we're not replacing continuing education. That's always there. And if people want to do that, that's always an option. We're just giving more options and more perspectives to better ensure continued competency. So I'm excited about it. I'm looking forward. From the National Registry perspective, the final thing that I'll add is we're looking to kind of pilot test some of these possible alternatives in the coming years. And we'll be working with EMS clinicians, certainly EMS educators and medical directors and others as part of the system to help us in these pilot studies to see if they work or don't work for EMS. So more to come on that, but exciting times ahead.
Oh, yes.
So thank you both for spending time with me today to talk about continued competency. And thank you as well for spending time. Stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications about upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.